Welcome to Academic Matters at LaSalle University. I'm Brian Goldstein, Provost and Vice President for Academic Affairs. And today I'm pleased to have Dr. Jeannine Uribe, Assistant Professor of Nursing in the School of Nursing and Health Sciences at LaSalle. Jeannine, welcome to Academic Matters.
Hello.
So I want to start by asking you about your background, where you were born and raised, what your educational background was, and how you came to LaSalle.
Well, I was born in Harvey, Illinois, and we moved over to Indiana when I was entering high school. Went to high school as a Hoosier, and then became a Purdue alumni, Purdue Calumet, and then Purdue West Lafayette, Big Ten football. And after that, I did some jobs and went to the Peace Corps, and then after the Peace Corps came to Philadelphia. Fell in love with the city. I came with my girlfriend from Peace Corps and just decided to stay. Met my husband, had my children, and at one point decided, actually read in the newspaper about LaSalle's program for public health nursing. Decided that was really what I wanted to do. I was not a hospital nurse. I was really interested in public health, and so came to the program and got my master's here. After that, stayed home with my kids, had a few more jobs, and then got my doctorate at University of Pennsylvania with a dissertation in nursing history.
So before we get to your doctorate in nursing history and public health nursing, talk more about the Peace Corps. What led you to go into the Peace Corps? Where were you? Because I think that has a relationship with what you're doing now. So talk a little bit about that.
I was really inspired by a senior professor of public health nursing at Purdue West Lafayette, Pam Altanon, and she had talked about migrant work. And so a girlfriend of mine and I went to Minnesota to work with the migrant health program in Minnesota and really saw disparities and some issues of justice for the way the migrants were living. I was completely frustrated by not being able to speak Spanish, but my friend Lisa was going on to Peace Corps, and so after that 6-week experience, I went to California and she went to the Peace Corps and would write me these intriguing letters about how she was interacting with the people, doing grassroots level work. And so she inspired me. I couldn't get a job in California. They had just had a nurses' strike, and so they were flooded with nurses. So I decided the Peace Corps was the way I could get my public health experience. And so I went to Paraguay, South America, for 2 years, 1983 to 85, and really lived in the most rural area. When people were talking about Y2K and fearful of not having services, I knew how to milk a cow, I knew how to take care of chickens, I lived with a radio and a few batteries and candles for 2 years, so that really was a wonderful experience.
So how did that experience inform and animate and sort of center you in terms of what you do now relative to nursing and even the work that you're doing here at LaSalle?
So when I came to the city of Philadelphia, my friend and I found a job tutoring in English. It wasn't a job, it was a volunteer at St. Veronica's in North Philadelphia, and we worked with the Hispanic people being able to speak Spanish. So then I could further check out the needs of the people. I went to Episcopal and did labor and delivery so that I could go into the community to talk to the women about maternal child care, which was a great love of mine. And I did home care in the community and saw all of the needs in the community and have tried to find jobs with Spanish speakers since then.
So that kind of experience, how do you utilize that in both your research and in your teaching and working with students clinically?
So my dissertation was about American nurses who went to Chile in the 1940s to start public health nursing. I really wanted to do, and will still do, the history of Peace Corps nurses because they were some of the first volunteers who went. But my interest was in American nurses who then went abroad. And so that is in the classroom as well because I teach public health nursing here at LaSalle, and I try to take the opportunity to take students into the Spanish-speaking areas to show them how it might be if they're not able to speak Spanish, but still have someone there to help them with a translation. And I also take students to Mexico City for spring break as part of their public health nursing clinical, which is just really a great opportunity for them to learn about the strengths of the Mexican health system and the Mexican people.
So talk a little bit about public health nursing and maybe how that differs from, if you will, the traditional bedside nurse that probably most of us have some experience with.
Yes, most people know nurses in white, in scrubs nowadays, but public health nursing is really about health promotion and disease prevention. And really, it's preventing people from going into the hospital. It's a struggle to get people to change behaviors, but it is possible, and so that's what we work with. We work with also social issues that they come up against that limits their ability to have health. So it's really an interesting job. It's not acute care. Most of the people are not acutely ill. They are living day to day and have health issues or maybe have struggles, and so that's what I really enjoy working with people to solve those issues that they have.
And what are students' perceptions and orientation to public health nursing, again, as opposed to the more traditional view?
Well, currently in the curriculum, it's senior year, and they're really gearing up for their licensing board and their licensing exam, and it really gets in the way of their studying. But once they're finished with the class, they really realize how important public health is to getting people to become healthy and to stay out of hospitals. There's not enough money to keep people out of hospitals completely, but we are working to make changes. And so they go into it thinking, oh, this is just boring, but they really come out of it realizing how people live in their communities.
And what do you see as the future of public health nursing and prevention as it relates to delivering health care in the 21st century, particularly in the U.S.?
There's talk about people coming out of the hospitals a little bit sicker and trying to prevent people from going in. So I see public health nurses as hopefully leading the way of the other healthcare workers that are in the community and being a part of solutions for policy changes and for changes in neighborhoods that in the long run will get people to be healthier.
So talk a little bit about then how that relates to the research that you do. Particularly, it seems like you've gone back to South America in some sense as your area of scholarship.
I'm looking to study that further, the students' responses to becoming culturally competent. And I'm actually taking classes here, which is broadening my knowledge as well, getting them to think critically. It's called critical literacy, and learning about how to take apart what they're reading so that they're not just absorbing what they are learning, but they're really critically analyzing it. And so I'd like to look further into that. And I also do nursing history research.
Right, so I know you were instrumental in bringing the Nursing History Museum here to LaSalle. So talk about that work, how people could come and see the collection, and maybe talk a little bit about what's in the collection.
It's a wonderful, wonderful spot to be at LaSalle in Old Germantown Hospital. People can really identify with old hospital settings, and we have our displays out on the first floor and the fourth floor, and we have our archive, and we have a Facebook page, a web page, and so we invite people from the community. People come from different states to visit us, and we have students able to just observe the changes of equipment from glass syringes to the plastic syringes. So we have a variety of displays, sometimes contrasting and comparing, sometimes showing war nursing memorabilia and pictures. We've had a lot of wonderful donations from families who want to honor, and in many cases honor their mothers who've made an impression on them and was so proud of her cap or her cape, and have many pictures. So it's really a wonderful place. And with being at LaSalle, it's open on Saturdays, so a lot more people can come and visit. And I must say, Dr. Zane Wolf was very instrumental in allowing us to come, and you as well, in allowing the museum to be at LaSalle. It used to be at Friends Hospital, which limited the exposure that people could get into the building to see the items.
So you specifically mentioned caps and capes, and there's quite a collection of both of those. So talk about the history of particularly caps and their importance to nursing historically.
The caps were an item that identified the nurse. She was easily seen wearing her cap, and they lost favor in the late 1980s. When I graduated in 1982, I had a cap. I had a bun and a cap posted on top of my head. Nurses found they got in the way, so they went by the wayside. But we still, as you can see, I have a pin on. We still highly identify with our caps, and nurses have kept them in good shape, have kept them in boxes, and are proud of them because they're distinct. Each school had a distinct cap.
So I want to come back to talking about the travel study course to Mexico, right, that that you take the students on. Tell us about that. What is that experience like? What is the students' reaction? What are they doing while they're out of country in Mexico?
This will be the 4th year that the students go, my 2nd year going. And we are in connection with de La Salle in Mexico City. And they have a beautiful campus where they bring in educators to tell us about the public health system, the disaster system, the insurance system. So we have classes, and then the rest of the day we will spend in the community, perhaps at an HIV clinic. We also get to see a lot of cultural, the pyramids and the different museums. So it's really a blend. And we have a historian who's one of our drivers, so he really can fill in any of the questions the students have. But they do have a public health interest in learning about how 22 million people can have their garbage taken care of and their transportation taken care of. So it's a beautiful city, it really is.
What are the typical takeaway messages for students? They come back and say what about that experience?
They were surprised that Mexico is a big city. They were surprised at the services that are available. We do see in the explanations that they have a big preventative health system. So they're promoting vaccines, they're promoting HIV care, they're promoting prevention that keeps people healthy because they have less money to spend on the hospital system.
So with such a large system though, and a focus on prevention, what's the sense of how they do that logistically? Because I think that's a challenge here in the U.S. that we've tried to navigate. Their
system of clinics and physicians owing to the system a year or 2 years after their medical school, because their medical school is paid by the state if their grades are high enough. There is a private system of education as well, but the physicians then have health posts and health centers. Everything is start local, then move up and move to regional. They have the Children's Hospital in Mexico City, so there's not as many of the tertiary care centers as we have. You know, when you look at Philadelphia having an MRI center within blocks, Jefferson, Pennsylvania, and all the hospitals so local, it's not that way in Mexico City.
Dr. Uribe, thank you for joining us today on Academic Matters.
Thank you.
Hey, what's up?
But I am beyond drunk and I am so hungry. You wanna go get something to eat?
Yeah, I only had like 2 drinks.
Okay, perfect.
Okay, yeah, meet me outside my house in like 5 minutes.
Yeah, I'll meet you at your house. Okay. Whoa, you're swerving.
I'm fine. You're the drunk one. I only had 2 cups. That's it.
I'm drunk. I thought you were drunk.
I'm not drunk. If I was drunk, I wouldn't be driving. It was just 2 beers. It's not going to do anything.
Hey, I'm Eddie Dunn, host of LaSalle's favorite TV game show, Q&A. Do you know that LaSalle TV is an entirely student-run organization? Probably, right? Do you also know that I happen to know all of the words to Eminem's Rap God? It's crazy, right? It's like 6 minutes. I'm not gonna do it here, but just trust me that I know the words.
3, 2, 1, action. You may think a guy would be producing this, but I can too. Anyone can find a cure.
Women are being downgraded for their physical ability, but you can be just as strong.
%20 of women are engineers, but it doesn't stop there.
I'm a tech girl. I'm a tech girl.
I am a tech girl.
I am a tech girl.